My name is Ruth Catherine Gama. I am an international board certified lactation consultant, and today I'm here to talk about breastfeeding. Breastfeeding, providing breast milk to your baby is the most important nutrition that you can provide to your baby. It's human milk for human babies. And the benefits of breastfeeding your baby are plenty, but we are going to talk few of those. And the benefits for babies are that it's going to reduce the chances to get sick and upper respiratory infections. Now with all this COVID and all the virus that we don't know, breast milk provides breast milk will help your baby to prevent upper respiratory infections. Also, it will reduce the chances for the baby to get obesity, diabetes at a late age. It will help also your baby to get some childhood cancers and protect the babies against many infections and ear infections. For moms, the benefits are also too many, but we're gonna talk about today about the mommy getting osteoporosis late in life. It reduces the breast, uterine, ovarian, and endocrine cancers. It will help to reduce the size of the uterus and helps to prevent bleeding. The breast milk is going to help to seal the guts and the intestine in the baby. That protection is going to help any foreign organism to penetrate in the baby's guts. By also breastfeeding your baby, you are creating a bonding, and baby is gonna start building secureness. Exclusively breastfeeding babies, that means that babies are only getting breast milk, no water, no food, and no formulas. What is a good tip for you to be an exclusively breastfeeding mom? First, as soon as your baby is born, you need to place your baby skin to skin. Babies are born with the instinct of breastfeeding, so we don't want to take away that initial instinct, but it's gonna only happen when you are close to your baby. Rooming in at the hospital is important because that will give you the chance for your baby to be with you and for you and the baby to start learning from each other. It's a process. So while you are with your baby in your room, skin to skin, make sure that you are relaxed and the baby is chest with you, and offer the breast often to the baby, or baby is gonna even crawl to go to the breast. That's the natural instinct for the baby. The smell of mom is very important. When you are with your baby, by learning from the baby, you are gonna notice when your baby is hungry. The baby is gonna start moving the mouth side to side, or putting the hands inside the mouth, or yawning, and then you know that baby is ready. Please do not wait until that baby is crying. When the baby cries is when we lost the clues before the baby was giving us. So we want a happy baby at the breast. When you get home and you feel that you are alone, no, you are not alone. The only thing is that you need to ask for support from your family or the community. Tips for exclusively breastfeeding. As soon as your baby is born, place your baby skin to skin. Babies are born with the instinct of breastfeeding. Rooming with your baby, that way you and the baby are gonna start knowing each other, and you will know when the baby is ready to eat. Avoid the use of pacifiers or the formula during this period. Formula will take time to digest, and babies are not going to be able to be at the breast as often, and your production is going to start decreasing. Once you finish feeding your baby, it's important for you to hand massage. That will help the production of milk to be stimulating too. If you need any support, don't be afraid. Ask for help. If you're at the hospital, call the nurse or the lactation consultant, and when you get home, you can ask help from your family, any friend, or any help in the community. We're gonna talk about the breast. The breast is a delicate part, and is made out of gland, fat, and ducts. The nipples, they have tiny openings. That is where the milk comes out. Those ducts are surrounded by muscular tissue that are gonna help when the hormones are stimulated to move the milk from your glands out. The areola is the brown part around the nipple, and that areola gets darker during pregnancy because it will help the baby, especially when the baby is born, to distinguish and to go to the breast. The areola has a little pimples that will help with the secretion of oil around that area to maintain it clean and lubricated. Those little pimples are called Montgomery glands. Okay, once how the milk is made. Once the baby is born, the placenta is delivered, and the levels of the hormone progesterone drops. As soon as the drop happens, is sending a message to the brain to start producing milk, because that body knew it had a baby, and that body wants to provide nutrition for that baby. So that's a normal reaction from the body. How the milk is made. Once the baby is born, the placenta is delivered, and the levels of the hormone progesterone drops. As soon as the drop happens, is sending a message to the brain to start producing milk, because that body knew it had a baby, and that body wants to provide nutrition for that baby. So that's a normal reaction from the body. The milk production is regulated by the supply and demand. The more the baby breastfeed at the breast, the more milk you are gonna produce. And when you have your breast empty, the breast is gonna start getting full again. So it's better for you to empty the breast. It's not gonna be empty completely, but if you feel your breast very soft, is when it's getting empty, and then the body is gonna produce more milk into that breast. But if you don't finish, if the breast is still hard, it's gonna take longer time to fill up the breast. So empty breast, it will be quicker to fill it up. You need to remember that you wanna breastfeed your baby at least 8 times per day. We're gonna talk about the types of milk. The first milk you're gonna produce is the colostrum. The colostrum is a milk that is thicker, yellowish, and you're gonna produce it before your baby is delivered, and it's very important for your baby because it's gonna be like the first vaccine. But it's important because it will help the baby to evacuate the pube. So if you have hard time feeding your baby at the beginning, please try to get this milk that is so important, massage your breast, and put it in a spoon or a feeding cup because you want to give this milk to the baby. How I said, it's thicker, so start massaging your breast and get that milk. The poop of the baby at the beginning is this color. Also, the stomach of the baby is gonna be very small the first day. So do not worry, baby is gonna get what the baby needs. But I wanna tell you is that the colostrum will help to remove that poop. Transitional milk is when you continue breastfeeding your baby and your milk production is gonna start going up. That milk has plenty of fat, vitamins, and nutrients that the baby will need. When you are going through this period, it might be the second or third day, I want to mention that the baby's poop is going to start turning greenish, and that's normal. Remember, the first poop, the baby was this color, but later, 1-2 days, the baby's poop is going to start turning this, and that's normal. That's what you want to see. If you continue, you're going to end up in the mature milk. The mature milk is that milk that is going to be very important because it has more vitamins, more proteins, more nutrients that the baby will need at that age. And around day 3, the baby is gonna be pooping this color. It's yellowish, seeded mustard color, and that's normal. And this is the size of a baby at around 3 days. So let's repeat it. I want to show you. Baby's first day is small, is like a grape, the stomach, and the poop is this color. The third day, the baby size of the stomach is like a cherry tomato, and it's gonna be this color, greenish. And around day 3-4, the baby poop is gonna be this color, and your milk production at that time is higher. They are gonna start pooping more. Feeding cues. It's very important that you're rooming with your baby, that you are with your baby close, because you are gonna learn from your baby. You are gonna notice when the baby start turning around side to side, or start putting the hands in the mouth, or baby is gonna start turning towards you. That's a clue. The baby is telling you that the baby is hungry. Do not wait until the baby cries, because you are losing all the signals that the baby was giving before, and you don't want to have a crying baby at the breast. If you miss your clues, please relax and make that baby happy, and then put the baby at the breast. Some of the breastfeeding positions, we're gonna talk about it, but I just want to let you know that you are gonna find the right position for you. It's not the positions we're telling you. You can practice from those positions, but you and the baby, you're gonna find the right position for both of you. The most important thing is, when you start positioning your baby, is put the baby skin to skin. Take the time. And then you need to make sure the belly of the baby or the chest of the baby is against your chest. Once the baby is aligned, you make sure the ears, the hips, and the legs are in the right position, aligned, so you can put your baby in a laid back position. This position is gonna help with the gravity. It's gonna be easy for the baby. You need to hold the baby's head and keep the baby close to your breast, and the baby will start crawling and going to the breast. Make sure when you are in this position that you have a pillow to support your back and your shoulders, and you just hold the baby from the back of the head. The cradle or Madonna is the most traditional position, and you are just gonna hold the baby, line your baby, and make sure, I repeat it again, make sure the baby is skin to skin with you. belly against your belly. The other position is the cross cradle. That will help with the babies the ability to move the head. And the football hole is a position that is very important that you might find if you have a C-section or if you have large breasts. The side lying position is a position that you are gonna do in bed and it's gonna help you to rest at the same time with the baby. Just to make sure that you are watching this, I wanna tell you that my favorite color is brown. Guidance for a proper latch. We're gonna start by washing our hands with soap and water for at least 20 seconds. And then we're gonna start getting and preparing the baby for the feed. We don't need to place too much clothes on the baby. If you can leave your baby just with a diaper, will be better. If the baby is too hot, baby's gonna be sleepy. We need an active baby at the breast. Then you're gonna start massaging your breast. We're telling the breast, get ready for the feed. So massage your breast, place the baby, align the baby in the best position that you have with the baby, and then start touching the baby with the nipple in the upper lip of the, or you can touch the nose. That way the baby is gonna react and is gonna open the mouth big, and that's the moment when you wanna introduce the breast. When you are holding the breast, you need to make sure you have the breast hold in the right position. You are gonna find some websites or some reading material that are gonna tell you hold the breast in a C, U, or L position. But it's the same, is this. Do not place your fingers close to the aureola. You need to be away because you need to grab in that C, U, or L position, and then remember, tickle the nose. Once the baby opens, you start introducing. The baby has to grab the nipple and part of the aureola. Why the aureola? Because the baby, by pressing in the aureola, is going to stimulate the ducts that are behind the nipple. And by the stimulation of those ducts, the milk is going to start releasing. Once your baby latch, that first latch at the beginning might be sensitive, but it's because your breast is sensitive and it's gonna get used to the breastfeeding and the baby at the breast. My recommendation is for you to, after each feeding, place some breast milk because breast milk heals and it's gonna help you. You're gonna feel like a burning sensation. It's like when you are in a cold weather and your lips start getting sore. That's the sensation. So put your milk into the breast to help heal for the first few days. Things are gonna get better with the time. Just give time for you and the baby to get used to this new norm. Once your baby start latching and you don't have that pain, you need to make sure the baby's lips are flared up. They are gonna be like a fish. You don't wanna see a nipple tucked in. If you notice the lip is tucked in, you need to just, with your finger, move it and the baby is gonna release the lip. You don't wanna have a painful latch because of that. So make sure, for a good latch, the nipple and the aureola are inside baby's mouth. The lips are flanged out. The tongue is over the upper gum, the lower gum of the baby, and the baby is gonna keep, and the baby is gonna be at the breast. Okay. You are gonna have a period that you feel your baby is eating off them. That's called the cluster feeding. Babies, they grow so fast, and the babies, they get ready for this growth, and they do it by feeding often because the mom has all the nutrients for that baby to grow. So by breastfeeding often, baby is eating and is growing. So be patient. You're gonna have periods that the baby is gonna be at the breast. You feel it like all the time. Another question that especially new moms we encounter is that, is my baby eating enough? You need to realize that you are the best for your baby, and just you have what the baby needs. If you feed your baby often, and if the baby is peeping and pooping, you know the baby is eating enough. I know we cannot count the ounces in our breast, but we can start seeing clues that you are gonna notice that the baby is satisfied. When the baby is hungry, the babies are tired. But when your baby start eating, the baby start relaxing. So we need to make sure that we know those signs, so it's gonna help us to know that yes, baby is getting enough. So relax. Make sure baby is happy, content, baby is peeping, baby is pooping, and you are gonna feel it also in your breast. Once you start the feeding, your breast feels harder. By feeding your baby, you are gonna feel your breast start getting softer. When you start feeding at the breast, I don't want you to start saying, okay, I need to breastfeed for 20 or 15 minutes. Please relax. Feel your breast, check your baby. Once you feel the baby had enough at that breast and that breast feels softer, you can switch to the next breast. But everybody's capacity is different. Your baby might be full with one, and if that's the case, the next feeding you start with the other breast. But it's okay if you offer both breasts, but please, when you feed your baby and you start with one side, try to empty that breast, because the meal that we have, the first meal is like a skin meal. Then we have the first is the skin meal. Later is like 1-2%, but behind that we have like the whole milk. That whole milk has more fat. Is the hen milk, and that milk has plenty of fat that is going to help with baby's brain development. The brain is ready to grow, and the brain cells are getting to connect. By you providing more of that thicker meal, hen meal, that fat is going to help the connection of the brain, and baby's brain is going to develop at its potential. It's a gift from you to the baby. So try to give that, and if you feel that you didn't finish, the baby wants some more, just switch to the other breast. During breastfeeding, you can look for some signs, and is that baby is eating at least 8 times per day, is making wet or poop diapers. In a day, you can count at least 8. Baby's gonna be active and alert. Baby's mouth is wet and the lips are pink. That's when you know that your baby is having enough. If you feel that your baby is not eating enough or you are not producing enough, please don't hesitate to call your doctor or a lactation consultant. Hand expression is very important when you start feeding your baby. The best way when you start hand expressing is to have your fingers placed at the right position. You can look at the breast, you can feel your breast, put the thumb on the 12 and put one finger on the 12 and the other one on the 6, 12 and 6, outside the areola. Do not touch the areola. And then you need to go towards your breast and then compress and release. That will help to release the milk, and continue doing it until you feel that trigger point, and you're gonna do great if you start knowing your body, your breast. It's very important that you tell your provider that you want to breastfeed. Once you are at the hospital, you need to tell the team at the hospital that you want to breastfeed. They have to respect you. You are the patient, and they have to follow your desires. Breast milk is very important, and at the hospital they are gonna offer you formula, but remember that formula is given by a company that wants to get your business. Breast milk is free, and you can have the breast milk available to the baby anytime, 24 hours a day. It's free and it's the best. If you encounter any issue at the hospital, you need to let them know that you want to see a lactation consultant before you go. Once you are at home, and if you continue or you have any questions about breastfeeding, don't forget to contact First Care Women's Clinic. They will help you. They will find you the lactation consultant that you need. You are not alone in this. The only thing you have to do is to ask for help.